Hello, welcome to Nclex Bits. Today we will discuss 3 of the must-know pharmacology questions. The nurse is caring for a client who takes metoprolol and has a permanent pacemaker. Which of the following finding would require follow-up? Client reports sexual dysfunction. Client reports history of asthma. Client has an apical pulse of 60. Client report not taking the medication for the last 2 days. Correct answer is 4. Metoprolol is selective beta-1 receptor blocker and must be taken as directed. Abrupt withdrawal can cause rebound hypertension, angina and tachycardia and may precipitate life-threatening arrhythmias or myocardial ischemia. Therefore, tapering the dosage over 1 to 2 weeks is crucial to prevent these adverse effects. Reports of sudden discontinuation or omitted doses should be reported immediately. The nurse is preparing to administer metoprolol to a client with atrial fibrillation and a heart rate of 133 who is experiencing palpitations. The nurse notes that the client's heart rate is now 51 on the bedside monitor and BP is 127/95. Which of the following actions should the nurse take? Notify the healthcare provider and question the order. Administer the metoprolol and monitor vital signs closely. Recheck the client's vital sign in 30 minutes. Mark the metoprolol as held in the medication administration record. The correct answer is 1. The client's abrupt change in heart from tachycardic to bradycardic indicates that the client may have converted out of atrial fibrillation into sinus bradycardia or atrial flutter with a ventricular response. The nurse should immediately notify the healthcare provider and question the order as beta blocker is no longer safe to administer. The nurse is caring for a 75-year-old female client who was recently prescribed hydrochlorothiazide. Which client findings would be most concerning? Increasing triglyceride levels, headache, nausea and lethargy. Rash on sun-exposed skin of the face and arms. Client has been urinating frequently at night. The correct answer is 2. Headache, nausea and lethargy are symptoms of hyponatremia, which is side effect of thiazide diuretics. Example, hydrochlorothiazide. This occurs when too much sodium is lost in the urine. Thiazide diuretics treat edema or hypertension by blocking the reabsorption of sodium and chloride. Don't forget, repetition is the key. Thank you for watching. Subscribe and hit the bell button for more Nclex content. Together we will smash the Nclex exam once for last.